Hello again, this is Joseph Adeboyega, PhD psychologist, licensed clinical addiction specialist in the state of North Carolina. I'm in private practice in Winston-Salem. The issue I would like to discuss today happen to deal with addictive personality disorder. This is the disease of addiction. I overheard two people talking recently, and one gentleman stated that his relative, who is a heavy smoker, was warned by his doctor to stop smoking, and that if he didn't stop smoking, he was going to die. And he said, in spite of all his health problem, his relative continued to smoke. And I said, what do you think he needed to do for him to stop smoking? The gentleman stated that perhaps if his relative was able to accept Jesus, he should be able to stop. And I said, okay, Jesus, I have no disrespect for Jesus, no disrespect for Muhammad, no disrespect for Buddha. But even though the issue of faith and hope and belief in God or Jesus or Muhammad or Buddha could help some people to quit smoking or using drug or drinking alcohol, there are some people it becomes very, very difficult because they are genetically programmed not to be able to quit. Or even if they quit, they might quit for a while and still continue to use. I told the story of a patient of mine who many years ago had quadruple open heart surgery. He had a quadruple bypass. And as soon as he could get out of bed to go to the smoke room, he was smoking. He was barely 55 years old. Shortly after that, he had a series of mini strokes, which left him paralyzed on one side of his body from head to his toes. Now, I would not believe that someone would knowingly want to continue to hurt himself or herself with a substance that they know is going to eventually destroy or kill him or her. If they could stop, it is not about free will, it is not about Jesus or Muhammad, but it is some people with hate, with faith, with hope, and maybe involvement in church might be able to quit, but not everyone will be able to quit. Some people will quit once and then they will be done, but some people will have to quit and relapse a couple of times before eventually they'll be able to quit. In a sense, involvement in church could help some people maintain a healthy lifestyle and keep themselves in a strict kind of regimen that would keep them away from going back to the old habit of using drug or drinking alcohol or smoking marijuana. So this is my humble opinion that, or my professional opinion that, whereas some people can quit easily, some other people is a lot harder. And I do not want people to think that just like some zealot, we'll call them Christian zealots, who believe that just with faith and some special prayer, some homosexuals can turn their life around and become heterosexual. If the person is programmed to be homosexual, if the person is programmed not to like women, or is a woman that will not like men, there is no prayer that can change that. That is my humble opinion. So it is a fallacy to think that simply believing in Jesus and accepting Jesus is going to help someone quit using drug or smoking or drinking alcohol. Thank you.